first places that I worked was a renal metabolic unit. We took care of dialysis patients, we took care of DKA patients, so we had insulin drips. We did pancreas transplants and kidney transplants. We did the one-to-one afterwards. One thing that I learned, though, I learned a lot of things there, but one thing that I learned specifically that I've carried with me forever and ever is no P, no K. Now, what that basically means, K stands for potassium. When you get a electrolyte panel or BMP, or CMP if you're adding liver enzymes and all that on there, when you get an electrolyte panel and you see a high potassium, that patient needs to get dialysis immediately. Usually they have their set days, but if it's a super high potassium and they are on dialysis, that could be very bad. So we want to be very careful about giving kidney patients or patients on dialysis, I should say, potassium containing foods, including things like oranges, bananas, even potatoes have a lot of potassium, believe it or not. So no P, no K, that hopefully can help you to remember that, hey, in a patient who has kidney failure, you really do not want to be giving them any foods that are high potassium containing foods, and you want to make sure that obviously they're not missing their dialysis because that's a big part about pulling off that extra potassium.